we're rolling. You said Jen, but I'm gonna still call you Dr. Jen.
Sure.
Tell me about your history, what you do, and the service you provide.
Sure. So I am a third generation physician. Of course, as a teenager, it was the last thing I wanted to do. But I met a super cool woman who was a mom, MD, PhD, and orthopedic surgeon in New York City. And so when I hurt myself playing college sports and she ultimately operated on me, I just thought it was the coolest thing ever. So at that point, I transitioned to becoming a wannabe surgeon. And ultimately, after becoming a surgeon, I went through my own sort of personal transformation, um, realizing that I was putting surgical patients through a really stressful, time in the operating room and not getting them ready for surgery in the way that is possible. So, what I have come to over the last several years of sort of evolving um, in this process is giving patients a surgical wellness approach. So, using my surgical expertise, I improve their sleep, stress, nutrition, diet, microbiome, and pain because I know what they're going to go through during the operation. So I know the position they're going to be in, how they're strapped down, the instrumentation being used, and I want to help a person have the best experience possible during a very stressful time. And using those wellness elements, I'm able to, this is all, scientifically based, I'm able to reduce risks, optimize outcomes, and accelerate recovery.
This makes sense because you said sports. I'm thinking of sports as an analogy. It's
Hmm.
kind of like, say you got a playoff game coming up. It's a big game. So it's a one and done game.
Hmm.
This playoff game is your surgery, but you just prior to that have no coaching, and you're just kind of like, yeah, just show up that day, and we hope it goes well, and
Right.
then like hope you feel okay after. See you later.
And the surgeon is incredibly highly trained, and in the operating room, things are quite controlled. But at the same time, getting the person into the ultimate health for that particular operation, I think could only be beneficial. And surgeons don't really have this on their radar. And then people in the wellness space or practitioners, they don't have the bridge to cover the gap between the need for coaching to get them into that game and through that game in the best way possible.
Yeah, this seems to come up more and more as I've talked to different doctors or different people in the medical field, and it's kind of like part of it is a product of the system that's created. Like surgeons don't have time to be doing extensive preparation and post care because they've got like they've got deadlines to meet per the system, and they've got you know student loans to pay, and they kind of have to, see how many patients they can in a day and do how many surgeries they can. And their kind of pre and post is like not really, the system's not really designed to.
I think the system isn't designed to benefit the patient in that way, but I also think that the surgeon has an enormous amount to think through and to make sure goes well in the operating room, technically. It is not part of our education,
Yeah.
wellness. I don't even maybe in medical school, we had a couple lectures on nutrition, maybe one on the importance of sleep. But, in a surgical education, you're just trying to learn how to keep the patient safe while you're making an incision and moving things around. I mean, in any other space, what I do is assault and battery.
Yeah.
Um, so we've got to be fairly perfect in the operating room, and that's heavy. That's a big task. So if I can, you know, take my own time and my own interest in the wellness space and apply it to the surgical patient and even help my friends out who are surgeons having better outcomes, better experience for their patients. That's what I like to do.
So you work independently, kind of regardless of who's doing the surgery. Do you do you try to, build some rapport with them or find out exactly what they're doing and then find the best way to set that patient up for that surgery, pre and post,
You mean work with the surgeon or work with the patient?
with the surgeon?
I do work with some surgeons, but I'm capable of helping any patient for any operation, regardless of what the surgeon's going to do. I, with the number of hours and years that I've been in and around the operating room, which at this point is 25, I've seen a lot. I can certainly read up on something if I haven't seen it in person. It is a lot of fun when I work with surgeons
Mhm.
and some of my good friends throughout the country doing anything from ACL repairs on professional athletes to big cancer surgery and just thinking through the different physiologies that those patients are going through. And then taking, like I said, the positioning in the operating room, type of anesthetic. I joke that even veins have feelings too. And so if we can really take a whole person, whole body approach and get that person ready for that specific, you know, operation, manipulation of their body, then we can have, improvement of nausea and vomiting, improvement of constipation, which is the number one complaint after any operation, um, improvement of blood flow through the limb that's having the ACL repair, and everybody wins.
So how did this whole journey start to get you to be doing this? So you
Yeah.
became a surgeon at some point. Did you have an expertise? What types of surgeries were you doing?
So I am a board certified general surgeon, which is a lot of abdominal surgery, trauma, robotics, cancer. It's a 5-year program after medical school, and I trained in Seattle. Um, there was a time, it was 2020, everybody's going through COVID. There's a big push for, whether certain supplements would be helpful in COVID. So there was a wave of that wellness that we were all riding. And I was reading a book called The Artist's Way, and it's a way to self reflect and do some exercises to sort of be more creative. And with my own health history, having chronic back pain from an injury when I was 13, I've been getting chiropractic care and massages for a long time. So I went to a therapeutic targeted massage and I walked by a chiropractor's room, a nutritionist's office, a place where someone is able to give acupuncture on my way to the massage room. And I thought to myself, like, oh my gosh, I'm not helping my patients get through the process of surgery. And it was that very specific moment when I realized that my patients, whether it's an inguinal hernia repair, breast cancer surgery, they would all benefit from chiropractic care, massage, acupuncture, better nutrition. And so I then started researching outcomes. If you improve someone's sleep, do they do better? I mean, common sense says yes. But in, you know, conventional medicine, we like a lot of research to back up what we say. So I then started asking patients about their sleep, about which, supplements they were on at home, their diet. And over time, that morphed into me trying this out on a good friend of mine. She had had uh, a biopsy that came back as cancer and had really struggled getting through that biopsy. And so I said, hey, like I'm coming up with this new process where we're going to meet a couple times before the operation and a couple times afterwards. I'm going to put you on these vitamins, this fiber, this probiotic. Let's get you to sleep better. And, what have you got to lose? You had a rough time with the biopsy. You're only about to go through a much bigger operation. So she was totally game. And I must say, she flew through the bigger operation. And this really morphed into an actual process and product.
Hi, folks. Quick note from me. If you don't already know, the goal of Mountain Mule is to build real connection between Montana's businesses and the people they serve. We provide private transportation services and Yellowstone National Park tours. If this episode or any other has given you something worth thinking about, smiling at, passing along, I've got a small ask. Share it with a friend, text it to someone, consider following the show. Whether you're using our services directly or following and sharing the show, those simple actions help support this business as well as the businesses and guests that have been a part of the show. Thank you for supporting these Montana businesses, local jobs, and this beautiful state. Now back to the show. Tell me, you said the book The Artist's Way. How did this
Mhm.
tie into this idea to take this more holistic approach to surgery?
I think that we in surgery, because the stakes are so high, we're very dogmatic, we're very rule driven, and we, for the most part, don't like to deviate too much from the norm of what we've been taught. So the artist's way had me thinking more creatively about life in general, about my own experiences, my own growing up. And I'd heard that there were some Hollywood writers who had read it and then come up with, interesting um, shows that were then huge, successes. So it sparks this creativity in you. And it was a time of a lot of change. And so I was able to think outside the box.
Do you know who wrote the book?
Julia Cameron.
I'm trying to think. I was trying to peek over there. So does this book have is this a book where you like write every morning? It tells you to like
Yes.
write 3 pages?
The morning pages.
Yeah, this is so funny. A good friend of mine, Foster Mobley, I think it's actually Dr. Foster Mobley, he did the podcast a little while back. The first time I met him, he gave me that book.
Really?
Yeah. And I still haven't read it, so now I'm feeling
I think maybe you should read it.
yeah. And he was saying this. He was sort of going through this phase in his life. I think he's in his 70s now, and he was not retiring per se, but pivoting a little bit,
Okay.
just trying to figure out, how am I? And he said he was just like open hand writing every
Exactly.
morning, 3 pages, and kind of just brain dumping.
Yes.
So that's why I wondered if that was the same book when you said that.
It's the exact same book. That's phenomenal. I think you should read it.
Yeah, I think it's a good sign too.
It is, yeah.
So you do this with your friend, and you guys have great results from doing this pre and post work.
We did. At that point, I was getting feedback that my patients were buying a lot of vitamins and taking a lot of pills every day. And people get pill fatigue, even if it's sort of good for you stuff. So I then created my own supplement, which had the wound healing vitamins that people are deficient in. Even the healthiest people don't get enough vitamin D in a day. About 95% of, adults in the United States don't get enough vitamin D. And then the levels of vitamin D aren't even adequate for wound healing. So the low level of normal is 30. And for wound healing, immune function, and mental health, which is important, especially in this state, it needs to be closer to 50 and then 70. So I made the supplement, and it has the vitamins and minerals that I'm wanting people to, really build up their reserves prior to surgery. Because when you go into surgery, if you have a problem, you can't make up for poor reserves at that point.
Yeah, it seems like the thought would be you want to get your body and your mind as strong as possible in your sleep. So like I don't know, I personally, and I say this all the time almost to remind myself that sleep is like almost the end all be all because the body just can't do what it's so good at doing when it doesn't have the rest.
I couldn't agree more. I mean, in general, more than 50% of, again, adults in the United States don't have ideal sleep. And then you add in the stress of either pain, anxiety from a disease, injury, difficulty sleeping before surgery. Then you go in and you have the pain of surgery itself. And maybe you were in a weird position because we do some pretty weird things in the operating room. And then afterwards, you're wondering, like, how soon am I going to get back to my regular life? So that in and of itself will disturb sleep. But if you really work on sleep ahead of time, you'll have faster recovery with better pain control, better mobility. And like you're saying, if you prioritize sleep, like some of the basic human functioning, your body will do what it's meant to do.
And I know you said vitamin D too, because that was a big one during COVID, wasn't it? That a lot
Mhm.
of
It
people
was.
with low vitamin D levels.
Yep, and zinc as well.
Yeah. And they kind of work in junction with each other.
They work in a lot of the same sort of spaces.
Mhm.
Vitamin D is relevant in probably, close to 10,000 different functions in our body alone. And zinc helps augment a lot of those functions.
So when somebody contacts you and you're going to start working with them, does it kind of depend on what the surgery is, and then are you doing like any blood panels on them? How elaborate are you going with the pre and the post and everything?
Yeah, I try and keep it really based upon those tenets of sleep, stress, nutrition, diet, microbiome, and then working on their independence and functional independence afterwards. I personally don't do a lot of blood panels. I know that some sort of wellness practitioners do. Anyone who's undergoing a really significant operation is going to have a blood panel anyway. Um, there are some studies, at least for orthopedic surgery, that say don't even bother to test for vitamin D, just supplement
Yeah.
because that's how important it is. Um, what we do is I have an initial consult with them, a real deep dive, learning about who they are as a person, what they enjoy, what fills their soul, what they haven't grieved in life, what they have grieved well, because a lot of skeletons come out of the closet when you're going to have an operation. And it gives me an idea of what to improve before they go into that stressful of an environment. So I get to know them really well. And then we set up a plan for how they're going to optimize their health prior to surgery. Very specific instructions for the day before, getting your gut ready, good sleep, like you were talking about. And I really love your analogy of that sort of playoff game, that game day.
Yeah.
I'm going to use that. I'm going to steal it.
Yeah, yeah, please do.
I think, yeah, hopefully it's not on that
No.
disclaimer.
No, no, you're good.
I love that analogy because you have certain things that you have to do for a couple weeks ahead of time. And then you have very specific sort of pregame or game day, rituals. As a surgeon, I have them to make sure that, I perform well, but the patients also need one. So then we also have a plan for after surgery in that immediate postoperative period when people are most stressed, most fatigued, in the most amount of pain. There are different ways that you're going to, respond than you will, 2 to 4 weeks after surgery. So I have a plan for improving all of those wellness tenets right after surgery and then in the second phase of healing. Healing, soft tissue and a lot of orthopedic repairs takes a full year to heal. So even though people are back out there, I had my shoulder operated on when I was a junior in college. I was playing, 3 months later. It's been 20 years. I still feel it's still different,
Yeah.
right? So um, you have to take into account that these are, in many cases, lifelong impacts.
Yeah. And when you say like a lot of skeletons, do you mean like people are having existential thoughts about what's going on, or like things they've done in their past that might be issues now? Like, what are you speaking to?
Sure. So it could be how they handled pain after a car accident. In some cases, surgery has a stress and cortisol response that is an equivalent of a bad car accident. So if they had nightmares after their car accident, if they still have, certain pain from, wrecking their bike, even when they're little, or, did they see their parents go through something when they were little or even as an adult and how that impacts their own thoughts on what they're going to go through.
When it comes to mindset, or is there anything you're trying to work with them to help them improve to just have a healthy mindset going in?
Mindsets are really important. If someone has a fairly positive mindset, then they've done a whole lot of the work. I think that Mantras can be really helpful, and there's some research showing that, having a positive mantra as you go off to sleep, actually has benefit. It really depends on the person. If they're interested in that, then we can certainly go in that direction. I think, um, having appropriate expectations and the more education on what they're gonna be going through often gives people a lot a lot less anxiety. So, I try and say, listen, you're going to be in this position during surgery. So expect these parts of your body to be sore. You're going to be wondering why, because it's 2 feet from the incision. Expect to have, brain fog for this amount of time. And they just feel better having an understanding. And then they're able to talk to their loved ones or whomever is going to be able to take care of them after surgery. And I try and talk to those people as well so that they have an understanding what to expect. Because this person who's highly functional is about to undergo, you know, a life changing process. And what does that look like for the first 12, 24, 72, 96 hours? And then, week or two after surgery.
When you think of this surgery date, or like if even if we stuck on the analogy of this game day,
Mhm.
um, I don't know why I didn't say World Series because I'm a baseball guy, but anyway, it's a playoff game.
'Cause
It's a
we don't
World
get the best
Series.
out of 7.
Yeah, yeah. It's game 7 of the World Series,
Okay, yeah.
and they say, uh, I usually sleep pretty well, but now I'm getting anxious.
Mhm.
So you're trying to because I mean, I'd imagine that night before that's when the most angst is going to be there, and then
Mhm.
that's the night where the sleep would be the most
Yep,
beneficial. So is this where you're
absolutely.
trying to help them sort of? It's kind of a like sleep could be tricky specifically because sometimes when you try to make yourself sleep, you deliberately keep yourself awake.
Absolutely. There are great ways to help yourself get to sleep, and some of it starts a couple weeks ahead of time. Where almost all of us, I imagine, are guilty of being on our phones before sleep, and poor sleep hygiene can be started better sleep hygiene to counter the poor sleep hygiene can be started a few weeks before surgery, um, which will, if you're in a routine, will help you significantly the night before. That said, I think that there are some great supplements that are helpful, and I'd like patients to try them before the night before because then they have an idea of what it's going to do to them. There are studies that show, specifically melatonin the night before breast cancer surgery greatly improves anxiety going into surgery. If you improve anxiety, you're then improving pain control. So it really is all linked. I think meditation is great, but it's not something that you can just pick up and do. I
Yeah.
mean, that's a real skill. So if somebody's interested in meditation, there are great apps and YouTube videos. Get started with that. I don't pretend to know all of the answers, but um, I think that there are many ways to improve the pregame, you know, um, routine.
Yeah, and just thinking about this, weeks, if not months out, and
Mhm.
training your body and your brain to hopefully just be able to put itself in the best case scenario
Yep,
day of.
exactly. Yep, you're gonna have better results.
We were talking a little bit before. I was saying that I have a family member that went through some surgery and some cancer stuff, and we're talking about the way the immediate family is there for that person, or it stresses that person out more.
Mhm.
How much of that do you try to talk to immediate family members? And I think you alluded to that a little bit, that you will talk to them and try to help coach them through.
You know, continuing with the sports analogy, I mean, it's a team effort and, um, everybody needs to be on the same wavelength. The, patient is gonna have their own expectations like we've been talking about, and the family needs to have them as well, and then there needs to be communication about how they're gonna work together afterwards. Um, if somebody is the more anxious, sibling or kid, how are we gonna handle that person's anxiety because it's something that is completely out of their control. Um, and I think that, pulling everybody together is more important during that time than almost any other time. I mean, if you think of something, worse, like a death, like everybody's gonna say, okay, like, how can we best support that person? Obviously, this is different, but we still want to use what we have as strengths and then see how those strengths are gonna help the patient undergoing surgery. I have also, told family members, like, "This is a long operation. You need to go do work. You need to sleep. You need to get, good food, so that you can be there to support the patient as much as possible." Everybody needs to take care of themselves.
Yeah, that makes sense. And we're going back to mindset. If you're or anyone is really stressed out, then that stress and anxiety is going to kind of bleed out onto the whole situation and can potentially make things worse.
Absolutely. I mean, there are biological, chemical processes, in our brain where stress, augments more stress, which then causes more stress.
Yeah.
Yeah, it can be a really aggressive, positive feedback loop. So that's important.
And I know we are going on this. What you were saying, sports is ultimately or originally what got you
Mhm.
into surgery because of what sport was it?
I played lacrosse in college.
Okay. And then you had an injury which led to surgery?
I did. I had hurt my shoulder a couple times in the past, but I took this great shot, scored. Um, we lost the game, but the next morning I couldn't move my shoulder. And then I would tape it up and I'd have these huge ice bags on it. And I was told, we're going to do our best to get you better prior to surgery or get you better and avoid surgery. But, I was super strong and still throwing my shoulder basically out of the socket. So at that point, you don't have much of an option except to go to the operating room.
His shoulders are rough.
They're
There's
tough,
issues.
man.
Yeah, yeah.
I know when it's gonna snow or rain, just like feel it in the sky.
Oh, really?
Yeah. I joke that I was scarred for life, which I was, but it was a really interesting office that I went to in New York City. There were orthopedic surgeons, non-surgical orthopedic doctors, nutritionists, exercise physiologists, psychologists. It's called the Women's Sports Medicine Center at Hospital for Special Surgery. And everybody sort of was involved in making sure that the athlete had the best outcome.
That's very cool.
Yeah.
Is that what like gave you a little bit of this idea later
I'm
to
sure it was part of it.
yeah.
I mean, my surgeon, I then worked for her for several years as her research assistant in the clinic, and to this day, she's still a mentor in my life. Um, I've, run this idea by her several times. She thinks that this approach to the surgical patient is a, very different way of doing it that hasn't really been done before. She's been very supportive. And yeah, I'm sure that her involvement and the relationships that I still lean on, 25 years later have had a big impact.
So you've had 25 plus years in the medical world and field.
Yeah. Plus all the dinner table conversations.
Do you have any big takeaways or any like what have you learned from seeing that side of the world, which a lot of us only see, unfortunately, if ourselves or someone is, you know, getting some kind of medical treatment?
Sure. First of all, we're all just people. There's a level of confidence that we have to do our job. You don't want somebody to take you into the operating room, put you to sleep, and then, use the tools that I use to fix somebody if that person isn't confident. That said, it's more of unfortunately, a business than ever before. And those of us who went into medicine and those who go into it now, we are not business people. We are constrained by, like you were talking about before, the number of patients that need to be seen. And at the end of the day, physicians are all in it to get people better. And I hope people understand that we're all just doing our best. We don't all have the best personalities. We don't all, make the best, initial impression or contact, but we're really there to help people out, and there's an enormous amount of sacrifice that does go into it. Financial sacrifice, time. There was a joke, there's no crying at the hospital, but, it was hard on us to be away from our families, to be saying no to our friends, and, in this pursuit of learning a craft to get people better when the stakes are highest.
Yeah, I mean, if you think of the time commitment and the financial commitment just alone, it's huge. And then you're in these situations where people's lives and people's families' lives are on the line. And
Yeah.
yeah, you are, I think, like you just said, you're a person. Like you're a person like everyone else. Yes, you are a doctor and you've very much earned that title through a lot of
Mhm.
hard work, time and money spent, but you're a person, you know, doing the best you can with the knowledge you have. So there's
Mhm.
um
And there is quite a bit out of our control. I think, one of the reasons why I have a real passion for applying wellness principles to the surgical patient is because, every surgeon out there has that case that sort of haunts them. The one that I think about on a more regular basis, was during my residency. I was a chief resident. It was my 5th year. The attending surgeon and I are just on the same wavelength. It's like this really great team experience. And afterwards, it just felt like it had gone really well. And then every complication under the sun happened. And I just feel like if I had had that woman, you know, appropriate sleep, appropriate vitamin levels, then I really could say I literally did everything that I could. Because everybody feels badly when something happens. The
yeah.
patient obviously is the one who suffers, but, surgeons, it's the last thing we want to have happen. So, doing literally everything we can is a real push for this for me.
And when you say everything went worst case scenario, that was post surgery, like
Mhm.
recovery.
Right. Yeah.
Yeah, it's so tough. And then if you think about it, probably the patient and all the family member, everyone's tension level is heightened because of the situation. So it's not like you're just having a regular cordial interaction with
It's not like
somebody.
the pipe burst and we have to fix it.
Yeah.
Yeah, I mean, this woman's life, wasn't ever the same. My life wasn't ever the same. Um, it's real high stakes.
Yeah.
It is. I heard a quote recently that there's no room for error in the OR, but enormous room for scrutiny outside of the operating room. Um, and if people understood that, we going back to what I said just a couple minutes ago, we really are doing our best.
Yeah.
We're trying.
And when you're saying, doctors have this level of confidence, is there anything, a situation where they don't? Like, if they don't have confidence, is there anyone that says, "Hey, we need to work on this"? Like, does that? I'm sure that situation comes up. I just wonder if there's any kind of coaching or anything that goes on.
That we go through.
Yeah,
Um, well, first of all, I think it's important to have confidence, but also important to have humility.
yeah,
I think you can do both. Some surgeons can't do both, but I think the best ones out there really do. In terms of surgeons being coached, for me, for instance, I learned robotic surgery after my residency. So that's a whole nother level of learning and training and testing and mentoring until I became proficient. If there's something that we're not confident in, first of all, I think it's important to know your boundaries and also know the boundaries of the people you're working with and the facility you're working with. That was taught to me back in New York City at one of the best hospitals in the world. Um, but you can go out and take extra courses. I think, I mean, I'm the daughter of 2 psychiatrists. I feel like just about everybody should be in therapy. And, sometimes your confidence is hurt. And then we come together as, colleagues to support that person through, whatever transpired.
and the residency and all the schooling and the
Mhm.
training is probably where a lot of this confidence is built just by the
Absolutely.
reps and the experience and the
Absolutely. Yep. The reps are important, being held highly, highly accountable during your training. I mean, we have a meeting every other week, at least in my training, that's how it was, called Morbidity and Mortality Conference. And you go up there in front of the whole program and you talk about your mistakes. And it's legally protected. So you can be really honest and open. And there are times when your mentors and the surgeons teaching you how to operate, they're really hard on you. But the whole purpose of that is so that when you're out on your own, you hear those conversations in your head when it's getting hard. I have scrubbed out and, if I'm in a situation that I'm not used to, I'll phone a friend. I don't have a problem doing that. Doesn't happen very often, once every couple of years, but if I'm in there and there's just a funky situation, I still have probably 100 different surgeons in my phone, and I am not egotistical enough. I'm not gonna push through. I'd be happy to get, advice.
and in this process, this biweekly process and the residency and everything else, this is kind of honing that confidence and that humility. It sounds
Mhm.
like when you're
Oh,
getting
yeah. You're
scrutinized.
humbled.
So you just hopefully by the time you come out of there, you're at a point where um you're not trying to be right. You're just trying to like have the best outcome for
Mhm.
the patient.
Absolutely. Yep, and there's a lot of nuance to it. I mean, we talk about the family. Sometimes the family, doesn't understand the brevity, of the situation, or, how maybe their family member can't tolerate such a big operation. So you have to be able to have the conversations to say, this treatment isn't the best treatment. That operation isn't the best operation. And so you have to be able to think about a whole lot when you're having these conversations. And so yeah, that's why the training is very intense. I mean, we're supposed to work no more than 80 hours a week. That was a law. We often work 80 hours a week and then study a bunch of hours beyond that. But the training is intense, and it should be.
Yeah, that's a lot of hours to
Felt like it, yeah.
yeah. Like a lot of people like to brag about working those many hours, but when you're doing something this important,
Mhm.
that's you're kind of pushed to your limits.
I mean, on a personal level, I never liked being wrong, and then I went into surgery and I was like, "Okay, you need to be able to take some pretty heavy criticism, because at the end of the day, this is about someone's life and you're in charge of what's going on."
So it probably gives you a pretty healthy mindset for the rest of life of just
It's pretty good.
yeah.
Yeah, I mean, my poor kids, they get some sort of cut or a sprain, and I don't have a whole lot of compassion 'cause I'm like, "Well, it could be a lot worse." Um, but in terms of, like, hard work and being calm under some, especially with trauma, being calm under some pretty unorganized circumstances, or um, it has certainly helped me get through those times.
You probably become a little bit I don't know if numb is the right term, but you definitely like build up some tolerance for what you've seen and what's
You have to, and there's a time when, you know, what is hitting the fan, where you really just have to push your emotions aside, push your anxiety aside, and just handle the problem. And then afterwards, you can decompress. And in big trauma centers, we have meetings after big, awful traumas so everybody can have closure to it. Because while you can be numb for a certain amount of time, you're never really numb for forever.
yeah.
Talk about the skeletons in the closet. If you're pushing down your emotions over really difficult emotional events, um, it's going to come back and get you at some point.
It's interesting. I'm thinking as you're saying you have this meeting after maybe this traumatic event or
Mhm.
traumatic surgery. It seems like you're almost taking what you guys do on the medical side of it and you're doing it for the patients because you're having these meetings after their surgery, which could be one of the most traumatic things they've gone through.
For sure.
So it seems like you're taking that philosophy that the doctors have for their wellness and
That's
well-being
true.
and taking it to the
Yeah.
patient in the in a very similar sense.
Yep, that's true. I mean, I think that being able to process these events, will only make you better and make you stronger, and
And yeah, I know you were saying that these are doctors, these aren't necessarily business people.
yeah,
You made me think of a family friend that I grew up with. I guess he's a little bit older than me, but we grew up with him and his some of his siblings. He became a veterinarian, and pretty early after becoming a large animal veterinarian, he bought the practice from the
sure.
vet that was a little bit retiring. And that is 2 totally different things. It's one thing when you're thinking, how am I a doctor, a veterinarian, and I'm gonna take care of patients, but then running a business.
Mhm.
So you're running a business now.
Yeah, it's really scary, and I don't know. I'm working at it.
How has that been for you? Because now
Yeah.
you're still in the medical, you're in the medical field per se,
Mhm.
not directly doing surgery, but you're also running a business. So how has that contrast been for you?
Well, for example, today I operated this morning
Oh,
and
really?
yep,
Oh, wow.
and then, came over here to do this podcast to promote what I am passionate about. And it's a very different mindset. It's a different transition. I've had no business classes. I listen to a lot of podcasts. I take a lot of notes. I think again, life's a team sport, and surrounding yourself with a good crew and I'm not going to pretend that I know a thing about accounting or finance. I bought a book once, like The Accounting for Dummies, and I
Mhm.
think 3 pages in, I was like, "This is not for me. My brain doesn't think this way. I just need a good accountant."
Yeah.
Um, One of the reasons why I loved surgery was because everybody has different roles, but it all has the same goal, and I think business can be the same way. And so, I joke I'm like the chief content creator, um, and luckily I have friends who are like in public relations or accounting, and I'm just going to let them help me out. They do what they do well.
And so would you say you're taking a surgical approach to business?
Yeah, exactly.
I think it's really smart. And speaking as someone who's had a very great strength of being able to figure out a lot of things on my own, and then also seeming that could be a huge deficit of trying to do everything on my own. But
Yeah,
I think to what you're saying, it really does take a team. And when you can stack the right team and the right experts, you can have like best possible outcome
totally.
surgery and or business.
Yep,
But it's kind of knowing what you're good at and staying out of the way of people who are good at what they're good at, not.
absolutely. Um, they're not trying to take care of patients. I shouldn't try to do a balance sheet, which is
Yeah.
a new term. It's pretty great.
You said surgery this morning. Do you mean you had a patient do surgery or you actually performed surgery this morning?
Oh, I performed it.
Nice. Very cool.
Yeah.
So you're still actively performing surgery as
I
well?
am.
Okay.
Yep. I do robotic surgery, breast cancer. Don't do a lot of trauma anymore, but let's see what else. Hernia repairs.
Okay.
Mhm.
So you're still a practicing surgeon and
Yes.
you're doing this service, like,
Additionally.
okay,
Yep.
very cool. So that's like a lot more nuance too. How have you been able how's been balancing the 2?
Ooh. Well, and then being like a single mom
Okay. And how many
to
kids
a
you have?
teenager. I have two
Okay.
daughters, 15 and 10, almost 15. I think someone said there really isn't a lot of balance in life.
Mhm.
It's just, one teeter-totter after another. I think that being able, especially in the operating room, is so great. Like when you're there, you're just doing one thing.
Mhm.
Um, so focusing on the task at hand. I talk to patients a lot about the importance of being present, in the moment.
Yeah.
Um, and that can really help you be more efficient, either in learning and executing a process and, getting through an operation. Um, just focus. And it can be really hard with all the distractions these days.
Is it this is weird, but is it meditative doing surgery because you have to be
Mhm.
so you're not gonna be on your phone. You're gonna be there, and
Definitely
you're
not
gonna
on
be
my phone. Maybe I'd have to think about that. That's kind of fun. Part of what I love about it is it's you, and honestly, they're really great people in the operating room.
Mhm.
I mean, the anesthesiologist, the scrub tech helping me, the nurses in the room, we're listening to music or giving each other a hard time. It's always been one of my favorite places to be. And that was one of the reasons why I went into surgery. The joke is don't go into surgery unless you hate everything else in medicine because it's the hardest. But it was the only place I ever wanted to be. Just felt at home.
Yeah. Do you hate everything else in medicine?
I do. Actually, not entirely true. I just didn't want to be the other things in medicine. I
Yeah.
mean, you need good pediatricians, but like that's not my jam. Need good cardiologists, but like I really can't hear the differences in murmurs. So, medicine is cool because there are so many different personalities within each part of it. Like you can tell who's going to be the pathologist, who's like never going to see a patient. You can tell who's going to be the anesthesiologist, who's just like, you know, good rapport with people, but puts them to sleep.
Interesting. That makes sense though, because
Yeah,
you probably see it later and you're like, "Oh yeah, that makes sense."
totally. And like the pediatricians, you can spot them a mile away. They're always the happiest.
That's so funny.
Yeah, or the goofiest.
Well, it's interesting because I don't have kids, but I love
Mhm.
kids. I love my nieces and nephews. I coached martial arts for quite a few years here. I did cab mentoring here,
Oh, nice. Yeah.
and I have so much fun with the kids. But I always say I love kids, but and I'm also like I just after I'm done coaching or done mentoring or done seeing my nieces and nephew, I
Yeah.
then go home
Mhm.
to where I don't have kids. So
Yeah.
so I don't know if that's I don't know if that correlates at all with pediatricians. And I want kids to be clear, but
Mhm.
it's really easy to say you love kids when you only have to deal with them like in small increments.
Totally. And I love my children. I love getting to know my patients at a different level. Um, but I also really like being able to use my hands to fix a problem so we can move on.
Uh,
My parents being psychiatrists, they'd have patients for like 20 years.
yeah,
I'm like, my gosh, how do you even have, I don't know, the cognitive ability to keep going through that? I am essentially like a mechanic. Um, but it's my own inner anxiety, my own lack of patience where I'm like, all right, if we have a problem, let's just fix this already instead of spending 20 years trying to do it.
yeah. So that's like a very surgical mindset.
It
Like
is.
there's
Yeah.
the
It's
problem.
what I
Here's
loved about it.
was that was there any what was it like growing up with two parents that were
Psychiatrists?
psychiatrists? Yeah.
I sort of joke that they drove each other crazy because when they met after medical school, my mom was going to be an eye surgeon and my dad was going to be an internist. And by the end of their internship, they were both going to psychiatry.
I thought that was funny.
Yeah. Like I just wanted to be angry as a teenager. My mom would be like, go figure out why you're angry. And I'm like, no, I just want to be angry. But quite insightful. And I did see a lot of change, through medicine that I can appreciate now more than before. I mean, I remember some of the concerns, between the two of them just on the way that medicine was going, and I think right now it's a lot more corporate than it was when I was growing up. And my mom's dad, my maternal grandfather, I didn't know him very well, but he was a surgeon, and I can't even imagine what his life was like as a surgeon in like the 50s, 60s, 70s.
It's interesting. My grandfather on my mother's side, and I never met him. He passed before I was born. He was a pediatrician.
Mhm.
He smoked cigarettes.
Right.
So
Yeah.
it's like
Yeah.
that's sort of the nuance of like what it was back then.
Yeah. Yeah. I know there are some, I don't want to call them knickknacks. That doesn't give them enough credit, but, gifts that my grandfather got from patients who couldn't pay the bill.
Uh-huh.
We have some big ship that somebody built out of like small pieces of wood. I mean, it's really extravagant. Um, I've gotten some cool, paintings and, that kind of stuff from patients too, but it was because they appreciated me, not because they couldn't literally pay,
Yeah.
yeah, for their service.
Yeah, and it is all business too. So that's where it's not like
Yeah.
I don't know, do you say it's not personal to business? It's obviously very personal, so, like, how do you
Yeah, I mean, I think that the business part of it is more administrative where, you hear the click clack of the heels coming down the hallway from, administrators saying, we need to talk about the number of patients that you're seeing a day.
yeah.
Um, I mean, as private practice is really hard. And people think that surgeons make a lot of money, and I'm not complaining. Um, but to be honest, a $25,000 operation, the surgeon may get $700 of that.
Yeah, I think that's, like, it's good that you say that because there could be this illusion that, like, you're just pocketing
Yeah, I
50%
wish
of
I
that.
was. Be
Yeah.
great.
Yeah,
I'd,
wouldn't that be
I'd
nice?
operate more.
Yeah. When you were talking about the robotic surgery,
Mhm.
that like, I'd imagine the technology is really good and pretty cool these
It's
days.
really cool.
Yeah.
Yeah, the minimally invasive approach, there are different robots. There's one for like spine surgery. The one that I use is great for the abdomen. I've not used it in the thoracic cavity. I'm not trained in that, and I know some ENT is using it as well for like tonsil and tongue surgery. Um, but it makes a minimally invasive approach even better. So when you don't make a big incision, the body heals a lot faster.
Mhm.
But the robot takes it to another level. So you can actually use less pressure, which the body responds better to. And everything pivots around one point. And so you're not pushing and shoving, um, you know, the minimally invasive instruments against a person. It's just all along one point, and it is really remarkable how people respond better to that. Um, the way that I describe it, we put these hollow tubes into the abdomen, and then we hook up instruments to the tubes. And either I'm running the instruments directly, and that's laparoscopic surgery, or I then hook the robot up to the tubes with the instruments, and I go to the console. I joke it's a gaming console, not quite, but and that's where I operate. So I have high def visualization, 3D imaging, and we have 7 pedals at our feet. So we actually operate in our socks.
Oh, nice.
And I had a coffee meeting a couple weeks ago at like 8 a.m. And then I had a case starting at 11, and I wore the wrong socks. I wore ones that were too thin. And so I literally went out and bought socks that I would want to operate in because I knew I was going to be at the at the robotic console for like 2 hours.
So these aren't required, but it's just preference of socks is what you were
It
saying?
was a preference of socks. The other ones were too thin. Yep. So these were more comfortable,
Yeah.
but we can't feel the pedals under our shoes.
That makes sense. Yeah,
Yeah.
yeah.
So we take them off, and but it's ergonomically much better on our necks. We're not staring down. We're staring straight up. The one thing that we can't do is we can't feel anything.
Yeah.
So the amount of tension that we put on tissue when we're operating on it is pretty much visual dependent.
It's interesting. I haven't the podcast hasn't been released yet, but I did one with Dr. Mackey. She's an osteopath,
I love Kirsten.
and she's talking about like her hands are basically feeling everything.
Oh,
So
yeah, she's great.
yeah,
Yeah.
that's a good point though. Yeah, because you're not like there's a disconnect, a physical disconnect
There
there.
is. I mean, when I'm doing laparoscopic surgery, I can feel, how hard something is, but not with robotics. They're trying to work that into the system, but the last time I heard it wasn't that great.
Do you have any like thoughts? Do you think of the way I would imagine the technology is rapidly evolving as it all is?
Mhm.
Do you see it changing the landscape a lot for surgery and medical care in the next decade?
Oh man. I think AI is going to do quite a bit. It would be great if we had some way of being able to sort of see exactly where the cancer cells are.
Yeah,
We can feel them in many instances, but it'd be really nice if like something just pink were to light up,
I see. Yeah,
in the middle of something that's yellow or something. Um, I think that will be helpful. I know that the robotic companies are using AI a lot to try and help us delineate anatomy even more. Not everybody's anatomy is the same. And when you get, an infected colon or an infected gallbladder, or a twist of, the intestines, everything's distorted. And so we have to think really hard about what that distortion is doing to where we're operating. And so having even more clarity when things are um, more difficult would be great.
Yeah. It's like all the rapid evolution is crazy, but
Mhm.
when you think of solving things like this and that like minimally invasive stuff,
Mhm.
like some of the precision, and I've heard like some stuff on different brain surgeries, and then you hear about
Oh, yeah.
Neuralink
Crazy.
and that kind of stuff, and it's
Mhm. And even, like, a lot of cancer, I had a patient, he recently passed away, but his metastatic lung cancer went into remission for a good amount of time because of some of the really high tech, medicines out there. His particular one brought his own immune cells and linked it to the cancer cells.
oh interesting.
Yeah, so we often have sort of out of control cells in our body all the time, and our immune system is able to recognize that and squash it. Um, Not to say we're having cancers all the time, but these out of control sort of pockets of cells can sometimes become cancer. And so, one of the most impressive innovations, probably in the last 15 years, is stimulating our own immune system to attack.
Oh, interesting.
And so his particular one, would literally bring his T cell over to the cancer cell and, like, link them so it could do its job.
So basically, it's stimulating your own body to.
It brought the cell that would kill the cancer cell right to it.
It's very interesting.
It's phenomenal. There are really smart people out there doing that.
Very cool.
Yeah.
Anything else crazy in the in the tech medical world that no one would know about, or
Um, I mean, I think that the robot has a lot of potential. I do think that you could hook somebody up to the robot and operate from another country. But with the amount of technology and AI that's going into life, I I think we're actually gonna go the opposite direction. I think we're gonna want more human connection. I think we're gonna I mean, if I call my sister who's in New York City, how do I know if it's her or, like, some what are they called?
AI bot?
Right.
Yeah.
Of my sister, unless we have, like, our little, I don't know, hand signal. Um, but I think that when times are tough and stressful, human connection is really what gets us through, and it always has. And this sort of comes back to why I'm doing what I'm doing. I mean, I wanna really take care of the surgical patient. I'm not there to do perioperative management. I'm there to do, like, high level patient support, which is really just going back to the basics of what makes us human.
Yeah, a little while back, I had Paul on from Umwelt, it's the new bathhouse that opened
Mhm.
downtown,
Oh, yeah.
and the thing they always came back to, and I feel like we get to it all half the time on this podcast, is a human connection. And
Yeah.
the thing about the Banya is you leave your phones upstairs, it's a no phone space, and
Sweet.
you
Yeah.
go spend time in community.
Mhm.
And I think there's probably a lot to be said about that, and a lot that's not measurable of how, how much that can change your healing and your recovery.
Absolutely. I think there's some cafes in Europe where you just leave your phone at the door.
Oh, nice.
Yeah. You just have to go in and talk to people.
There was I don't, I'm gonna butcher it if I think of it, but there was some, like some sort of tragic I don't even know a bunch of people were trapped somewhere. I think this happened out in Montana somewhere. There was like cannibalism going on and stuff, but they realized that like I think almost all the people that survived had children.
Hmm.
And it almost goes back to the community thing of,
Yeah.
when you're going through surgery, do you have what's your will to live?
Right.
Like, do you
Yeah.
have children or grandchildren or a community you're a
Mhm.
strong part of? And I think if you don't have any of that, like your will to live has to go down.
It's
I would imagine.
certainly yeah, it's certainly different, or if you've lost that connection,
Yeah.
like we're saying. Um, Actually, one part of medicine that I think is going to change is microbiome stuff. We have 3 to 5 pounds of bacteria in us and on us, and we actually have as many or more bacterial cells on us as we do human cells. So we're sort of only like half human.
Say more
And
about that.
so, yeah, I mean, the gut microbiome is only one of the microbiomes. We have them in our nose, our mouth, our lungs, our skin. And each individual microbiome communicates with the human body and the mind. I mean, they talked about the gut brain axis.
Yeah.
There's this skin brain axis, the skin gut axis, where there's just this really impressive intercommunication. I think I read a study the other day where there's like a gut musculoskeletal joint axis. So if your gut microbiome is happy, you actually have less inflammation within the joints. In the driest part of your skin, you have like a couple hundred bacterial cells. In the quote, dirtiest part of your colon, you'll have billions of bacteria per square centimeter. Like a centimeter is actually really small. A dime is 1.8 centimeters. So imagine like half a dime and you have 30 billion bacterial cells on there. Those are in constant communication with us. And when you have stress and injury, food poisoning, that gets out of balance. And that will actually affect, a lot of you. How you handle, your day at work, your relationships, your sleep. There are, I mean, this is sort of gross, but there are fecal transplants for certain conditions. Even like Parkinson's, which is a neurological condition, has been shown to improve with certain fecal transplants. So how do you explain that?
So you're taking like a healthier biome and doing
In
this
the gut.
transplant, and then
Mhm.
this will, in theory,
It
help
has
this colony
Parkinsonian.
community. Yeah.
Yeah. And then that communication to the brain. It's phenomenal.
I mean, this makes sense. It sounds crazy, but it makes sense.
Yeah. And then, for the people that I see, everybody's getting IV antibiotics within, 30 minutes of me making an incision. So how is that affecting their gut microbiome? People have diverticulitis. We're seeing a lot more of that because of big weight loss from these new, weight loss drugs.
Mhm.
So one of the ways that those work is to slow your gut down. And when you slow your gut down, you make constipation worse, which then makes the colon angry, which also disrupts the microbiome. So we're seeing a lot more diverticulitis, and those patients will get a couple weeks worth of antibiotics. So you have the insult from the infection, you have the insult from the antibiotic. The whole thing's disrupted.
Yeah. I mean, I like try to avoid antibiotics at all costs. Like, but also obviously there's a time when they're very much needed and a
Mhm.
huge miracle. But I think just not to like throw antibiotics at everything too is,
I agree.
yeah,
That's probably a good way to live.
yeah. And
Yeah.
I'm just going off of the stuff I've learned on podcasts.
It's a good source of
I've
education.
got the medical knowledge from the same place you got your business knowledge, which
Right,
is all pretty
exactly.
much from podcasts. So yeah, I mean, like what you were just talking about, like with fecal transplants and all this. So like everything you've seen in the medical world,
Mhm.
25 years, like does this change your whole outlook on life? Like what's possible? Do you think the human body is, more incredible when you go through 25 years of this or
I it's like the more you learn, the more you realize there is to learn. And I mean, this is sort of bigger topic, but when I think about the universe in general, it's like we have certain chemical processes, that take thousands of years, and then other ones that take an amount of time that I can't even imagine. We only see a certain amount of, the wavelengths out there. We only hear a certain amount of the wavelengths out there. I think I saw on, Instagram, another part of my education, where like the hummingbird or something else just sees a completely different world than I do.
yeah.
I just find that so fascinating.
I mean, you're talking to a guy who lays in bed sometimes at night and feels his heartbeat and is just
Mhm.
perplexed by the
It's
fact that it's
amazing.
just sitting there beating.
And it started out as like a long tube,
Yeah.
and then it curled up in a certain way, and over, millions of years or however you wanna think about it, like, it worked to move the blood in a direction that works for you. 2026.
I yeah, I just heard something the other day, and I don't know what rabbit hole I was down hearing this, but it was saying basically, like, when an embryo is developing,
Mhm.
before there's even a heartbeat, there's, like, a pulse, like a
An
detect Yeah.
electrical that's what you're actually detecting when you first, at the 6-week or, 8-week mark, it's actually an electrical pulse that you're measuring.
Yeah, I think the concept is how, like, everything is energy, we're energy, and, like, you can detect this pulse before there's even a heartbeat, and,
And I
like,
joke that I, like, cut through energy meridians all the time.
just say more about that, like,
Well, I mean,
that was an evil laugh.
but I mean, I think that, for people who are very, energetically inclined, I mean, some people just sort of go through life not ever thinking about it.
Yeah,
But for, you as a person thinking about that initial, beat as electrical impulses, and even now your heart is beating based upon electrical impulses. The gradients, of potassium or calcium, running down certain cells, those are electrical gradients and concentration gradients. But um, in Eastern forms of medicine, you have these energy channels that are
yeah,
running through your body, and so I'm like, listen, like I personally love acupuncture. I think
mhm,
it's great. My daughter loves it. She's the most relaxed that she can be after an acupuncture treatment. Um, but with people who come in and say like, I just feel like my energy's not right. It's not flowing. I'm like, well, I mean, I make incisions through those channels all the time. So, if, if maybe I had one in my shoulder that my mentor cut through,
yeah.
and if that disrupted whatever balance that there is, getting that back into balance can only be helpful.
Oh, that is interesting to think of.
Mhm. I make midline incisions, and there are studies that show that the mitochondria, which is another hot topic in medicine, in the legs are affected by an incision in the abdomen.
Interesting.
Yeah.
I think I was asking Dr. Mackey about that because I was just kinda getting the concept
Hmm.
of her, what she could feel, and I was telling her about a friend that said he went to, like, a Reiki healer,
Oh yeah.
and I've never done acupuncture or the is it Reiki? Am I pronoun
Reiki. I don't
Reiki?
know.
I've never done those, but it's interesting to think about the concept, and,
Hmm.
I think whatever rabbit hole I told you I was down was talking
Right.
about that energy pulse, but I'm not a doctor or a scientist, but I don't think there's any denying that there's some sort of electrical energy that flows through us.
I mean, our brains are like a 10-watt light bulb.
Yeah, that's very interesting.
Yeah, not very bright. Not like those lights.
Or low voltage.
Yeah. Um, I don't know about you, but once in a while, I feel like I meet somebody who senses things differently.
Yeah,
Um, there's a woman who, I get a massage from every once in a while, and her massages aren't typical. She can sort of feel, and Kirsten's, Dr. Mackey's very much like this too. She can like feel the parts of my body that are sort of out of whack.
yeah.
And that's I'm pretty sure she wouldn't describe it that way, but, for somebody, I'm much more a mechanic, but, there are people who can just sense, little vibrations in parts of the body, that should or shouldn't be there. I think it's phenomenal.
Yeah, a while back, I had a girl, Lydia, on, and she's a masseuse, and
Mhm,
she was saying that she can almost, like, pick up on when she's giving a massage to people on people's energy, and
mhm.
sometimes it can be exhausting.
Oh,
And I'd
oh,
never
yeah,
thought about that. I'm like, wow, just actually exhausting if this person is chronically stressed out and who knows what's going on, and
sure.
you are making direct contact with them, so you're
That's true.
basically absorbing whatever that is.
Yep,
It's kind of interesting, and I know that I sometimes it's, like, to a fault, but I can feel it around certain people,
sure.
and I think we all do to some degree. I don't know.
Feed off each other.
Yeah, and I can't compare mine to anyone else's because I only know my experience. But like some people will really drain me out, and some people I'm like I can't, and then some people I'm like, man, I'm hanging out with
Invigorate
that
you.
I'm hanging out with that guy or that gal more
Yeah.
because I'm ready to go. But it is very interesting to think about.
I think being in touch with yourself and what you're feeling is really important and hard.
Yeah, yeah, it's easy to want to just avoid it sometimes.
I mean, yeah, just zone out and watch TV or Instagram.
Yeah,
Learn about the hummingbirds.
I think this all comes full circle though to why people like it could be very helpful for people to get around you and like plan this stuff out for
Mhm,
these surgeries and
mhm.
think about these types of things of how am I setting myself up to succeed
Right.
and have the best possible outcome because some like the smallest things can make the biggest
A really
difference.
big difference. Yeah, I mean, back to you bringing up sleep. I mean, who doesn't want just a really good, restful night?
Yeah.
And how much better do we feel once we've had that? We can handle so much more in ourselves and a loved one who's going through something hard. Um, Bringing, I think, care back to the basics is a great way to make the overall experience better. And the more technical we get, the more AI driven we get. I don't want to lose that. I don't want to lose, you lying in bed at night thinking about the pulsation in your heart. Like that's so important moving forward in this kind of crazy world.
Yeah, and I think you're spot on. I've said something similar. I think people in business are always saying like, how can you have like a one to many thing? Like how can I do one podcast and a million people can do it? So
Mhm.
like think how efficient I am. I think the one to one thing that you can offer as a person or a business is
Mhm.
gonna be the most valuable
I
and
agree.
the highest because it's that personal experience. We can all, serve a million people and see a million people and stream stuff, but I think that human connection is going to become so much more valuable as we become a little bit more disconnected.
I agree. And I think getting underneath formalities, I mean, there's a time to be formal. Um, but just getting on the level where you're like talking person to person and human to human.
Yeah,
Yeah.
yeah.
This is sort of silly and who knows if I should say this or not, but like
Say it.
I dressed the part, right? I
Yeah.
dressed the surgeon part today and I'm like, I should have just been my more casual self.
Hey,
But like,
but think how honest you're being now. You're being honest in saying that because we're
yeah,
sitting here face to face. So
I mean, I want people to take me seriously as a surgeon, and at the same time, I also want people to know that there's an insanely human element to medicine and to operating. And I'm trying to, optimize that.
I'm right there with you. And like when I'm out there in the world, facing clients
Yeah.
and partners and everything else, when I'm in here doing a podcast, I'm usually in my hey dude slippers and I'm
Yeah.
very comfortable and I'm like,
Yeah.
I'm hanging out. This is the fun part. So
Yeah.
yeah, I wish I was just that more when I was out in the world, but there's
Yeah.
a level of professionalism where that
Hmm.
is appropriate to hold sometimes. I think more so in your case as a surgeon.
When I'm in clinic, absolutely. I need people to see that I'm confident and competent. And that's kind of the fun part of the OR.
Yeah.
We can be
Yeah,
ourselves.
yeah, yeah.
Like if I need to listen to like, I don't know, Snoop Dogg or something because that's where I'm at,
Yeah.
then we do.
And you're even saying like in your socks, pushing the
In my
yeah.
socks, pushing the buttons. Yeah. I'm like, gosh, guys, like what music is this? Who put this on again? We just give each other a hard time.
If my surgeon showed up in pajamas and hey dudes, I might have been like, I think I want to get a second opinion.
There is a
Yeah.
formality that you need at certain times. And there's also and that's why I think that, a lot of surgeons don't need to do the work that I'm doing
Hmm.
because they need to stay formal and they need to stay focused.
Yeah.
And if I can, talk to the patient about how to get them back very specifically to what they do best for fun and get to know them on a level and then use my surgical expertise to get them there, then I hope I'm doing everybody a favor and I sure love what I'm doing.
Very cool. I think
Yeah,
it's very cool that you're doing it. And I meant to ask you, do you do this only locally or remotely with people?
all of it.
Very
So I
cool.
meat with people, at an office, and I also do it via Zoom, um, with people all over the country.
Very cool.
Yeah.
I think it's very cool what you're doing, and you bring a very cool, just level of knowledge and expertise into it with your experience. And yeah, I think it's sweet. I'm like gonna just keep going on sports analogies because
Yeah, no, we
I
could
was
do that pretty much the whole
well,
day.
I was just telling my fiance the other day that I think someone said LeBron James sleeps about 12 hours a night.
Mm,
And you think about the level of athlete that he's at.
mhm,
So he's that prepared and he knows how important sleep is.
yes.
So it's almost like if you told every patient, like, just, look at this as game day. This is the biggest day of your life. So,
Mhm,
like, look at what LeBron does because he could be arguably at the top,
totally.
for about like all time basketball player. And look at the way he takes care of himself to show up. So,
Yep, and, another analogy is, when I talk to people about breath work,
mhm.
I'm like, "Listen, the Navy SEALs do this."
Yeah,
And, like, I actually know a Navy SEAL, and I just made sure that that was correct. He's like, "Oh, we totally do breath work." He's like, "Before we're going into something really crazy," he's like, "we're all doing it." I'm like, "Okay, well, if a Navy SEAL can do this, then, like, you can too to calm yourself down before this or, to deal with any stress in life."
yeah, that's so smart because it's such a big, any
Mhm.
type of surgery is.
And you have your book Breath up there, which is a great book.
Yeah, I've read that a couple of times with that James Nestor, I think. I think that's I'm
Yep.
just yeah. Yeah, that's I think I've listened to the audiobook and read it and there's so much
So much in
about
there.
breathing.
Yeah.
It's
I'm like, "Get the tape out."
yeah.
Yeah.
But yeah, you're
Breathe through your
right.
nose.
Yeah, yeah, yeah. Oh, do you ever I mean, do you like yeah, 'cause yeah, you tape your mouth, breathe through your
It's
nose.
one of the things that he talks about, yeah.
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 I've done that like on and off for sleep because
Mhm.
it's like I don't know, there's a lot of research. It's in his book and it's all over the place, so
And honestly, if placebo works 20% of the time,
yeah.
if it's not gonna hurt you, go for it.
I've done it when exercising or doing cardio and trying to
Oh,
just
yeah, yeah, yeah.
it'll burn, like, if you don't,
Yeah.
but I feel my nasal pathways getting stronger as I'm doing it, but they
Congratulations.
kinda burn. I'm
They
like,
look stronger.
"Thanks, yeah, I've been flexing them."
That and your
Yeah,
biceps.
thanks. But, yeah, I don't know, like, yeah, that book, I don't know, there's all kinds of stuff.
There are some really, helpful books out there. Kristen Neff, she does a lot on self-compassion, which is really important. It's not feeling sorry for yourself. It's like, let's be honest with what we're going through, and then we can, again, process that and move on. Um, I met a great acupuncturist at, a meeting in New York City, and just learning about the science of how acupuncture works. I mean, it's been around for 4,000 years. If it was that ineffective, it would have died out a long time ago, kinda like phlebotomy, but, um, a lot of good stuff out there. I think, more is being talked about in the microbiome. I think brain science is just, phenomenal. Um, yeah, I don't know.
Yeah, well, I appreciate what you're doing. I got a book to read now that you brought up
Yeah,
The
Artist's
Artisan's
Way.
Way.
Mhm.
Where can people find you if they're curious about what you're doing and
Yeah, my website is centerforholisticsurgery.com, and I made it that name to sound oxymoronic because holistic and surgery don't really go together. Um, they can learn about me there and email me and reach out, and I'd love to chat and learn more about people and how I can best help them.
cool, well, I appreciate what you're doing. Are you on social
Mm.
media or anything?
I am on social media. I'm on LinkedIn. I'm on Instagram and Facebook, though I should be more diligent.
Cool. Well, whatever links you send me, I'll put in the
I
description.
appreciate it.
Dr. Jen Stevane,
Yeah,
thank you for your time.
thank
This
you.
was a fun conversation
Cool.
and appreciate what you're doing.
Yeah,
Thanks.
thanks. That was fun.
Yeah, that was great. Thank you. Thanks for listening, folks. You can find the full blog post for every episode, along with key takeaways and links at mountain-mule.com. If you haven't yet, consider following the show. That one small action helps these Montana businesses get seen, grow, and thrive, and it helps this podcast keep going too. If you know a business that would be a good fit for the show, we'd love to hear from you. Just reach out through the website or social. Thank you for supporting these Montana businesses. See you on the next show.